Welcome everyone, welcome to our webinar, Overview of Medical Software for Allied Health. I am Katrina Otto and this webinar is brought to you by AHPA, Allied Health Professions Australia. It will be recorded, it will be available for you tonight. The PowerPoint presentation I am using will be available for you to download after this session, and all the resources that I mentioned will be available for you. They've been created for you and we will be giving them to you free of charge, all from AHPA. This is webinar 1 in a series of 4, and the first webinar, of course, tonight is looking at the software. Then we'll go on to webinars 2, 3 and 4 that you can see there with the dates. Resources to download will be available from AHPA's website as well as my website, and I've created a free resources Allied Health Providers page for you there. So please know this presentation will be on there at the end of tonight. So I will be going quite fast. This is a webinar that is completely for you, looking at software options. So when we're talking about allied health professionals and talking about the importance of allied health professionals playing a role in communicating as part of the patient's healthcare team, I would like to talk a moment about a little bit about my background. I am Katrina Otto. I am a medical software trainer and a practice management consultant. And while I have had my small business, Train IT Medical, for 11 years, I have actually been working in practices for 27 years. Like most of you, I chose a career as an allied health professional back in the 90s. But unlike you, I actually loved the practice or business management side of things, and I've always loved education. So that became my focus, and I did an adult education degree and have combined practice management with education ever since. So I teach medical billing, I teach practice management, I teach at TAFE, I train all the major medical software programs used in Australia. And I also offer consultancy services. So I literally work with thousands of clinicians every year. And I also manage about 12 on a consultancy basis. Most of the practices I work in have allied health professionals, and it's rare that I work in a general practice these days that doesn't have allied health professionals on staff. So I just love how we are moving into our integrative care model, and that's why this slide showing the importance of communicating, that's what we're going to be focusing on tonight, but starting with that very, very first point, which is, choosing software. So if I just move ahead, we are digitally connected. I actually like this stat here, 82% of us go online for health information. I certainly do that, and I also would say I certainly go online and I Google health providers. So that's something I think we should all be aware of as well. I took a little bit of a snapshot from the registration. As I said, 416 people registered. I did this on the weekend. And this just shows the range of allied health professionals who are tuned in tonight. So this snapshot, I guess, shows us that it really is quite a challenge to find software that does meet the requirements for all the different allied health professional groups. And this here is the software that you are currently using. So this is, it was an optional question. So we had, 145 people say no software out of 200. Okay, so the rest were saying these were some of the software choices. And that's a variety, but this is by no means the list. So I'm going to show you the list that we created tonight. I asked you that question, what software are you currently using? We researched, we are obviously working with many of them on a regular basis, but I wanted to see the whole snapshot of what it looks like in Australia at the moment. So this is my wonderful trainer, Sue, has been contacting all 35 software companies, all who make allied health products that we feel may be relevant for you. We asked about their features. We compiled a list. We sorted via your commonly requested features, as well as what we know to be features that will improve practice and business efficiency. So how do we know what your requested features and your challenges are? Because we asked. So we asked when you registered, and overwhelmingly, this was the response that was echoed by many. So we also asked at a roundtable event. So this was a workshop that I presented back in December with AHPA and a lot of the government agencies, your or 22 member associations with an industry representative, and we looked at these aspects and challenges and barriers to overcoming progress with digital health, because we very much need allied health professionals to be connected digitally and part of a streamlined conversation and sharing patient information securely. I have this whole presentation, so don't feel like you need to read this slide, but I think it's a really good picture. We brainstormed, what are your barriers? You know, was really good learning, and we took a lot away from that, and importantly, we took away the learning that the very first barrier is software. So you need software. We've created a list. You can see this is our work in progress, and the idea of this is in no way is it a list that's going to let you look at it and say, yes, this is the software for me, but this is the starting point. So that list identified of barriers, identified a lot of barriers that weren't related to software. We're focusing on software tonight. We've created a contact list so that you've got a quick list in order to go, well, who is it that I need to go and contact? That spreadsheet lets you investigate options. But before you do, I have to break it to you. There is no perfect system. A lot of you have been sending me request lists, what you would like to see from your software. And I actually do think allied health is probably the most challenging area because you are diverse, 22 specialist areas, yet you're grouped together. I imagine Australia can't support 22 allied health specifically written software products. And then with competition, you'd have to have 2 or 3 individually designed software products. There wouldn't be enough business for those companies with our constant changes like e-health, the NDIS, health fund claiming, etc. So even within your individual professions, you'll do things differently. I mean, you've told me some of your micro specialties, you know, lymphedema therapists, mental health OTs. It's wonderful, but even within a practice, people work differently. So I just wanted to lay this foundation first. We can't expect perfect, even in general practice. And I train the most commonly used general practice programs, Best Practice or BP Premier, and Medical Director, Praxsoft, which you may have heard of. I am Switzerland. I like all programs. I'm neutral. I don't sell any of them. I'm all about using technology to improve your practices and enable you to spend time with your patients. Actually, my goal is that you don't have to work at home at night. That would be a good goal, that you can actually use the software within the way you work in your practice. So let's set that as one of the goals perhaps. I can't tell you how many of you registered for this webinar at 11 o'clock at night. I do understand. So that is an aspect of software, looking at the benefits. And when you look at the benefits and the features, just an idea, but one of the things that we do with general practice software is we kind of break it down into an admin component and a clinical component. So if you think of it like that, an admin component, and actually some of the GP software, they have separate modules. You know, so they have BP management, BP clinical, they have Prax office, medical director, quite separate. So it kind of, the idea of breaking it down, I think, will be helpful when you're trying to choose software. So what we're all trying to do here is we're trying to prioritize and refine your priorities, because we're not going to get everything that we want. And this is a good snapshot, I think, here too, based on your feedback, because you do work differently. I mean, I have not had a great demand for group appointments until now, but quite a few of you said that that's something that you really need from your software. Billing NDIS, this is new. Integration with Xero and MYOB. So Xero and MYOB are accounting programs. So this is another aspect that's important. So when we're looking at features, this is a very long list just of admin features. The goal will be for you to be able to say, which ones of these do I need? What are my must-haves right now? So must-have versus nice to have. So we've got the clinical features, of course, as well, and by that I'm talking about things like your all-important, your clinical notes. Can you do shortcuts? Can you create your own templates? Is there voice to text, or do you need voice to text? Can you do your own diagrams if you're working in musculoskeletal areas? I imagine that would be most important. So these are just ideas to help you, and if anything's jumping out at you right now that yes, just write it down, because the goal is to create a priority list of what you need right now from your software, and then to be able to go back perhaps to the spreadsheet and go, which ones do what I really must have right now. On our spreadsheet, and this is just our idea based on, I have been training medical software for 20 years now. So it not only breaks down into admin features and clinical features, just a snapshot, but we've also then gone to technical, is it a cloud-based software? Now that is really a huge feature that a lot of you wanted. By cloud, we mean not stored on your computer, so perhaps not having to have that hardware component to consider for your practice. We've also got aspects of free trials and training. I'm a trainer, it's important. So it is, go back one. So it is the features and benefits of a cloud system. That's just a bit of a snapshot of a cloud system. But this is where you'll look at which features are your must-haves and then say, what are the benefits? And what are the risks? Because the benefits need to outweigh the risks. When you look at our spreadsheet, you'll see we're not often comparing apples with apples. And this is a really important thing. So that's why I was saying you might want to start a list now of your features. And when I say that, if you tell me that you are digital health compliant, what does that mean? You saw my list of what digital health means. It means secure messaging, it means telehealth, it means my health record, it means wearable technologies. It's an umbrella term. So if you say, yes, we're digital health compliant, that doesn't tell me enough. So the goal is to get your list, and then we'll really need to find out more from each vendor. That's why we want to narrow it down. A good example is this beautiful little machine here, AHPA terminal, that changed our world. Now it might just look like an ordinary terminal. It's actually a Tyro terminal. And I don't know if you've heard of Tyro, but it's a bank. It's a competitor to the big banks, and it just does this integrated FPOS technology. I am also a Tyro trainer, as well as being a trainer for many of the software companies, as well as the peak bodies and the government. This integrates with Medicare. So some of the bank terminals do too, but often it's a significant practice efficiency to choose one over the other. So that's the dilemma. How do you know which one is better? Do you even need to communicate with Medicare? Or Tyro now has HealthPoint, so it can communicate through some software with your health funds. Is that a priority? Is that a must-have for you? So of course, HiCaps also communicates with your health funds. How did you know that there was more than one way Tyro is not going to tell you to use high caps. High caps is not going to tell you to use Tyro. Which one's better? So herein lies the challenge. So what we've done with this PowerPoint is to, and our resources, is to put a whole lot of links so you can download them, you can click straight on them and find out more about those features that you've identified as must-have, that you've then said, okay, yep, these software products have this must-have feature. So you're going to be saying, these are my must-haves, these are the features, I'll learn more about them and I'll find out more from the software company. This one here, this list of key features, is a list that you identified. So this is what you told me were the things that you wanted. I thought it might be quite helpful. So it's a bit of a summary form. So ease of use. I mean, how, you're not going to get that from the spreadsheet. So how do you, and it's a really important feature. It has to be easy to use. It has to be, I call it intuitive, so it makes sense when you use it. So some of these features are really important. Break it down, maybe the top 10. The idea being to design a system for prioritizing your individual practice needs and implementing the changes. So when we're identifying and prioritizing those key features, list the features you require, and then, as I said, categorize them. Must-haves, nice-to-have. Prioritize the must-haves. What's the most important to you, and assess the suitability. Now that could just be 5 things on that list at the moment. Simple. So if you look at it as a really simple way, this list is going to be different for everybody. But the idea is you take the software products and you say which ones can do that. We created a form for you. This will be available for you to download after the webinar tonight. And the idea of this is that you'll be able to go through, you've got your top 10 features, prioritize them, go through the spreadsheet and go, which software actually does what I need it to do? Assign a priority and then identify and go. So identify these software providers and then go to the software providers and ask them. So whatever your features are, create the list. This is and we've even given you a contact list. So we've created a one-page contact list with all the emails and websites and phone numbers. But this is an example of a list that one of the allied health professionals attending tonight, one of you sent me, and I'd love this list. I hope you don't mind me sharing it. It doesn't give any identifying features away. But I just think it's an enormously helpful list. I know a lot of the software vendors are listening in tonight, which is credit to them. I think every software vendor should be trying to learn as much as possible about what you will want from your software and continuing to grow and develop features for you. But what I love about this list is it really highlights how differently allied health works, and for some vendors that will be newer than for others. So I strongly encourage you to tell your vendors, which is what we call the software companies who make the product and develop the product, the vendors. Tell your vendors what you want. I get frustrated because health providers in the field tell me every day what they like and don't like. No one ever hesitates to tell me what they don't like about their software and ask for things. And I tell, but the vendors often say, nobody has asked for that feature, Katrina. So you need to tell them what you want, really important. And I like this one here. So booking appointments, having them display in a weekly or daily calendar and linking to your iPhone. So this is very progressive and aspects that clearly show, converting activities into billable hours and billing directly to the NDIS. If anybody's just getting a computer, this may be an overwhelming list for you. But I thought I'd include it because it creates a good snapshot of where you will go on this path step by step. So you start with the must-haves and you end up with the I really want all of these bells and whistles. At this point in time, we probably won't get all of these bells and whistles. The NDIS is quite new, for example. So they're not perfect. I think of it like pieces of the puzzle, and we're building that puzzle, trying to get all the features and all the pieces that we want. But you are a very diverse group of clinicians. So being able to build the software that works exactly for you, that's a hard ask. So even in general practice, every general practice, while it's very similar, works differently. And I constantly use the term workaround. Actually, no, the software doesn't do that. We'll have to do a workaround. So one of the suggestions I would make tonight is that you try before you buy. So define your questions, sort out what you would like, define your questions for the vendor, ask them for reference sites in the same profession as you, and trial before you buy. So by going to your list of features, sorting out what exactly do I need to ask my vendor, what more information do I need, refining that list even more, and then asking them for people who are in the same profession who are using their software and trying it before buying. That would be a good approach, I would say. Learning Objective 4 is about having a planned approach to increasing use of clinical and practice management software. So what is your goal as a practice? If you look at this approach, so which functionality is going to bring benefit to your practice? So what benefits do you want? What's your goal? I mean, I imagine a lot of people, the goal is going to be, I want to have more time with my patients, less paperwork, less admin, improved efficiency. I want to be able to increase revenue. I want to be able to improve clinical outcomes. So that's what I would be thinking of when I was planning. Well, what features and what benefits do I want to see and do I expect to see from those features? So once you have, set goals for yourself, and it could be just a little goal, don't start small. You're busy, monitor progress. So one of the really good things about, one of the benefits, huge benefits of computers is they give us data. Now data lets us analyze and improve our practices. So we can see easily how are we increasing our revenue, how are we improving our communication, how can we see that information has been received, been sent. This is all technology benefits. Communicate successes with your team and take one step at a time. And I put this picture in here for all the occupational therapists. My sister is an occupational therapist. She is a fabulous case study. I have been stalking her on her home visits, and I have been making videos of her having physical consultations and using a laptop for you, which I will bring to you in future webinars. The reason she is such a good case study is because for she doesn't love technology like I always have. She never even had an iPad or an iPhone, but for 27 years she hand wrote her notes. Fabulous clinician. And then one day her workplace said to her, you can't handwrite your notes anymore. We have to be electronic. So that was a massive change for her. Change is hard for anyone. It took 3 months, and now she says she will never look back. She has more time. She never takes work home. She has improved her efficiency, and it has streamlined communication between all of the therapists and clinicians who treat the patients. So for tonight, the message I would also like to share with you, my tips, are to talk to others in your discipline, so your allied health discipline, but talk to people who like technology would be my suggestion. So in addition, ensure that if you have staff, that you train them well. One of the challenges of my life, having trained medical software for many, many years, is that we don't know what we don't know. So yes, software should be intuitive, but clinical software, if it has all these bells and whistles that we want, we need to use it well. So training is important. Super users are important. So the people who like technology within the practice and will be the go-to person. There's often, hopefully, one person around you in your life who does like technology and can assist in that regard. And then moving forward from a business perspective, ensure that that training is included in induction so you're always using technology to maximum efficiency. And one last little tip I would say is to think of technology as an investment in your business, as an investment in yourself. In my business, got zero as a bookkeeping program after having a standalone system of MyOb for many years. I went to zero in the cloud, and it cost me $50 a month, and I am a small business, but it was one of the most significant business improvements I did. Time saving, efficiency, and it's actually turned what was a chore that I did not like at all into something that takes very little time that is actually quite pleasant to use, which is quite amazing when we're talking about a piece of software. So think of technology as an investment, not as an expense. And think of it as an investment. You're important. Your time is important. I don't want you to be working at midnight. So think of it as an investment in yourself as well. And wherever you are on that path of technology, now's the time. If you're already using technology, if those who sent me your wish list, now's the time to go, does the software I use do that? Talk to your vendors. They are listening, and find out when that feature may be planned. Have a look at our future webinars where we'll go into more detail on how you use different software. So looking at how software can help us. I'll be talking about contacts, referrals. I'll be talking about secure messaging. So in here it's about building the business, building your reputation. As I was at a specialist event presenting on secure messaging, and the specialists were new to secure messaging, and one of the specialist practice managers said, you have to do this because it's 2017. And it's very true. It's about your business needs to be keeping up, needs to be seen to be modern, and we'll also look at, for those who are making the huge change from paper-based to computerized medical records, how you include and efficiently collect your notes, whether you're in a physical-based profession or not, how you can use some of the technologies to streamline efficiencies with that. And of course, webinar 4 will be on digital health, a topic I think I did 76 presentations across Australia last year on my health record. Go and ask me a question. All of this information is available on my website if you would like to do some if you don't want to wait till August to learn more about that, but I will be covering digital health for allied health professionals. On my resources list, there is a checklist for allied health providers related to digital health. There's also free e-learning modules. Your primary health networks, I'm not sure if you are aware, but your PHNs, as they are called in your area, are very much looking to support you, to engage with you. Historically, the role of Medicare Locals was to support general practice, but that's changed now and they're really looking to engage and help you. So please know AHPA and my website will have all the resources for you, the links to further information that we develop, and your support around you from your organization as well. So I would like to finish off tonight by saying a huge thank you to everybody who has joined in tonight. I would like to say thank you to Sue for helping contact all the vendors, putting together the resources. We are here to help you. Thank you to AHPA for putting on these webinars, and we will get back to you very soon as we develop more webinars and as we help you to support you with your digital health progress.